So my breathing is much improved from when this first started 10 weeks ago. I still spitting up a little bit of blood after I wake up, but it's like mixed with the spit, so it's not like a red. It's more like a kind of light color, so not much blood. And yeah, my heart feels normal. When this first started, my heart was beating weird. It felt like weak, like when I get tired or sleepy, I'd like try to like fall asleep to bed, and as soon as like I was about to fall asleep, I'd have felt like a jackhammer or something hit my chest, and my heart would just beat like race real fast, and then I'd wake up all of a sudden, and my heart was just weird for about 3 weeks, especially the first 2 weeks. It was just like beating oddly, and it didn't feel right. So my heart symptoms have gone away, but my breathing problem's still there. But it's not as bad as it was. It's every week that goes by, it seems like it's improving bit by bit. So I'm not normal, but I still feel a little bit of breathing difficulty. But it's like night and day from when like the first 4 weeks when this happened. Unfortunately, I still don't have a diagnosis. I'm kind of frustrated about that. I've seen the ER doctors, of course, at first. So when you go to the ER, it's just if you're like literally dying, because otherwise they're not going to diagnose you. They don't consider that their job. So unless like you're literally got like a bone sticking out or your blood is coming out of your body, like you don't expect to get any kind of diagnosis, because they're not going to diagnose you. They're just going to tell you to go home. Piling up. I mean, I got the health insurance. I'm paying $380 a month with Blue Shield. But I don't know, it doesn't seem like it's covering my expenses, because the CT scan costs $1,500 out of pocket with the insurance. And the emergency visits, the two emergency visits, it's totaled to about $3,000. And so yeah, it's all piling up, and but I have to find out what I have. So I'm going to be working with my pulmonologist, my cardiologist, and my internist to figure out what the heck's this is, and to get like a solid medical evidence-based diagnosis. And that way I could at least know how to deal with it, maybe prevent it from happening again, get treatment for it, etc., etc. So I'm gonna, even though it's kind of breaking the bank for me right now, I'm going to keep going until I have a solid diagnosis, because then I know what I'm fighting. You can't fight an enemy that you don't know what he is, and you don't know how to fight him. In order to get any kind of treatment, you have to get a diagnosis. And it's been frustrating, but I'm relieved that I am getting better and I'm getting back to normal. But this has changed me. Really focus on getting my life back on track. And that's my Chihuahua here. He wants to come sit down with me. Here's my little boy. Well, old man, he's 15. He's been with me for a good long while. Huh, Gekuri? You've been with me for a while, huh? We've been together, huh, since you were a puppy. Oh, yeah. So, it's been improving. I've been having, sort of been feeling, better every day. And here's my terrier. His name's Kuchi. He's 7. Oh. Hey. It's my boy. It's my other boy. I don't know. So, but what can you do? You know, what I guess all you can do is live life. You know, maybe we should be like our dogs. You know, we're not even worry about it, not think about it. Just live in the present.